Welcome back to The Winning Leap. Today we're talking about workplaces of the future, and while it may seem that Indian organizations have their work cut out for them, there are those that are leading the change. Let's take a look. When imagining workplaces of the future, there are Indian companies who are embracing the change and galloping ahead, both in terms of human resources and unimpeachable leadership.
Having a very strong leadership pipeline is central to success. Not for any other reason, I think, but for the simple reason that the cost of failure arising out of not having the right people at the right place can be extremely devastating. And when we say leadership pipeline, it's not just do I have the right people at the top. It's almost like having an entire pipeline which can continue and maintain the momentum of growth that is required.
Strong leadership has always been the key to motivate productivity in a workplace structure, and the dismantlement of traditional approaches in favor of modern organization demands future-ready leadership.
It's not about breaking the existing models or dismantling it. I think if it's working well, please carry on with it. What has to be seen is it relevant to my journey? If I'm looking at aggressive growth over a very short duration of time, I have to see whether the way I have been traditionally doing development, will that help me do that? If it's not, then you have to do something else. You may have to dismantle it.
We've spent enough time looking at strategies for workplaces of the future. It's now time to take you into a workplace of the future. I'm here at Narayana Health in Bangalore, which is one of India's largest and one of the world's most economical healthcare service providers. Let's take a look. Narayana Health was started in 2000 as a 225-bed cardiac hospital. Since then, the NH group of hospitals has grown into a healthcare conglomerate, servicing patients in all areas of medicine. A pioneer of the concept of telemedicine in India, today it has 150 connected telemedicine centers across the world. With its ability to leverage economies of scale and technology to deliver quality and affordability, Narayana Health is truly a workplace of the future. A success story in the booming healthcare sector. I'm here at Narayana Health with Group CEO Ashutosh Raghuvanshi, who's going to give us an insight into what it takes to structure an organization to such dizzying levels of success. Welcome to the show, Ashutosh.
Thank you.
So let's start with a basic question. Tell us in a nutshell what it is exactly that your company does.
I think our company does a simple thing, which is to relieve pain. We're into providing healthcare, and that is our basic job. The focus of our company is to provide high-level tertiary care to as many people as possible at a very economic level.
What is really your organizational structure here? And basically tell us, what is your recipe for success?
I think the reason why we have been so successful is that we engage with our patients a lot on various levels, how we train them, how we treat them. So that's the organizational structure which delivers it. And when you are working on a principle of providing high quality care at an economical price point, you need to have a very robust backbone which gives you information to make the right decisions. So IT systems become a very important part. Analytics becomes a very important part of our business. And those functions are supported by a corporate team which works centrally.
So let's talk a little bit about IT. I believe your institution is really renowned for your modern, the technology that you use. And this is what makes you stand out and perhaps makes your services more affordable as well. Talk to us a little bit about that.
We've been using the technology in critical care where our nurses have iPads. They are able to feed some of the observations of the patient they are attending to directly into the pad. Some of the information about the patient which is collected through the monitoring devices, etc., automatically gets populated onto these devices. Even if the nurse is less experienced, she can deliver the same level of care as a very experienced nurse would deliver. And there are so many other ways in which technology helps us. As you said, that how it helps us to reduce the cost of treatment. Now, what we have been able to do is our entire IT technology across the network is on a cloud environment. One of my hospitals, suppose, doesn't have a radiologist. another radiologist from another one of my hospital can report. At night, I don't need to have 32 radiologists reporting if there is an emergency. One person can report. They can also report from home. So that improves their quality of life, that improves their satisfaction levels in working with our organization.
And tell us, in your opinion, how important is it to set up an efficient leadership pipeline?
What we have been doing for last about 7-8 years is that we have created our own pipeline of leadership. What we have done is we've started hiring from business schools about 6 years back after we created a program. And in that program, we hire fresh pass-outs from business school. We hire people who have experience in other industries, not necessarily healthcare. Once they have gone through their about 1.5 years of orientation program, depending on their aptitude and skills, we put them in one function. But we are trying to grow them as future leaders. Some of them who joined us about 6 years back are managing few of our hospitals today. How
important is it really to go beyond the organizational boundaries and look at the needs of a very segmented workforce?
I think an industry such as healthcare, you have to look much beyond what happens within. This country has shortage of physicians, this country has shortage of nurses, and any other category of human resources you can talk about in healthcare. We run a scholarship program where we take children in 7th standard and we mentor them and encourage them to become doctors. And these children are essentially from rural or underprivileged backgrounds. Now, why we do this? Why we do this is very simple. The complex branches of medicine, say neurosurgery or heart, cardiac surgery, these are difficult branches. Children coming from privileged backgrounds, from urban areas, they don't want to go to those kind of professions. You need people who have fire in their belly, who want to really prove themselves. These are one of the things, one of the ways in which we are engaging with the community at large.
It's been a pleasure to get an insight into the inner workings of a hospital. Thank you so much for being on the show.
Thank you, sir.
Well, that's all we have for you today, but do join us again next week as we explore more core issues that are plaguing the effective development and growth in modern India. Until then, from the entire team, many thanks for watching.
Focus, ideate, innovate, enable.